Hello and welcome to the MedEdit podcast, your ultimate resource for evidence-based medical education.
On today's episode, we talk all things influenza, from seasonal human flu to the bird flu.
Flu is hitting everyone hard right now. At the time of this recording, 36 states have a flu activity of high or very high, which is a little scary.
Not only that, people are starting to throw out the P word, or pandemic, when it comes to the bird flu.
Geez, that's no fun at all. We do not need that again. Well, stay tuned as we break down the current facts, symptoms, prevention, and treatment of flu and more.
We are your hosts, Dr. Cari Sorrell
and Dr. Jessica Gray.
Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the MedEdit podcast.
So overall, respiratory illnesses have been very high lately. It seems like everybody's getting something, but especially the seasonal flu.
Absolutely. It's awful right now. Well, according to the CDC, there is currently an 18.7% positive test rate for influenza A this week, a number that is currently rising. Currently, the predominant subtypes are influenza A, which that covers the H1N1, the PDM09, and H3N2. This is important for healthcare providers and the CDC to know because it can predict how effective last year's flu vaccination was and will be against these current strains.
And it sounds like a scary number that 26,000 patients were admitted to the hospital this week for influenza, but overall pretty good considering the mortality or death rate. It was only about 0.5%. And that number is actually staying pretty stable despite the rising number of cases.
We are referring to influenza A. So for clarity, we're going to break down the difference between influenza A and influenza B. I know at least in my clinic, when we swap people every day for this, they're very curious. What does it mean when I have influenza A or B? And then this week I had someone very sick that said, do I have the bird flu? So, we're going to break it down for you, delve into this a little bit more so we understand when you hopefully don't, but if you did get that diagnosis, what's going on? So influenza A, flu A, and influenza B, flu B, are both types of the flu. And they cause similar symptoms, but there are some differences between them. So for example, prevalence, flu A is more common than flu B, especially in adults. Severity, flu A is usually more severe, unfortunately, than flu B is, but both can cause severe illness. Host range, so flu A can infect humans and animals.
So we've seen,
while flu B only affects humans. Spread, flu A spreads much faster than flu B. Seasonality, flu A usually appears earlier in the flu season than flu B, which is interesting because I feel like flu season just hit hard right now.
Yeah.
I felt like it was delayed. I was telling all my nurses and staff, I felt like this was going to be a bad flu year. It's coming. And then I kind of thought, well, maybe it's not.
Right.
Because it hadn't hit yet. It's hit here now. And I do see a ton of flu A. So if that means this is going to be a late season flu year, we better buckle up, right?
Yeah. Because we're also in RSV season, and COVID's around as well. So.
Yeah, it hasn't gone away either. So mutation rate, flu B mutates much more slowly than flu A. And then as far as pandemics go, flu A is really the one that causes the pandemics that we see when we're talking about flu, huge widespread cases. Flu B generally doesn't do that as much.
Yeah. And overall, the reason that getting the flu can be scary, a lot of people have had flu-type symptoms or known somebody with it, but really the worry is about complications related to the flu. You can get anything from sinus and ear infections to even pneumonia, which is an infection of the air sacs of our lung.
Absolutely. So other serious complications triggered by the flu can include inflammation of the heart. So you can actually get myocarditis, brain, you can get encephalitis, or muscle tissue issues like myositis or rhabdomyolysis, which is always one of my favorite words to say, which is that breakdown of that muscle tissue that can be it can be life-threatening. It can hurt your kidneys. It causes a lot of damage. And then, of course, there's something called multi-inflammatory response in the body that can lead to sepsis, which is the body's life-threatening response to infection. Flu can also make chronic medical problems much worse. For example, people with asthma may experience asthma attacks while they have the flu, and people with chronic heart disease may experience a worsening of the condition triggered by flu. People with diabetes can have really uncontrolled blood sugars, which can end them in the hospital. People with diabetes can go into something called DKA. So you can go from, getting the mild flu to all of a sudden having just these out of control underlying comorbidities that really put you at risk for having serious complications or ending up in the hospital. For example, one of my patients actually this week, she doesn't have a lot of risk factors necessarily, but man, that flu A hit her hard. And so we were in my office giving her an IV bolus of fluids, just really trying to tank her back up to keep her out of the hospital.
Yeah, absolutely. And thankfully, those serious complications are not common. So that's the good thing that we see. And pregnancy is another really high risk group for that as well. So we see some serious complications in pregnant patients also. People ask, what are the symptoms of the flu? So, fever is one of them, which we kind of categorize as 100.4 degrees Fahrenheit or higher. You can get aching muscles, chills, headaches. You can also get a cough and runny nose and sore throat, which we see with some other things.
Right.
Usually there's a feeling of being tired or weak, fatigue. Sometimes you can get a change in sense of taste or smell, just like with some other things that we know of. Some shortness of breath or trouble breathing. And then in children, sometimes you can also see more nausea, vomiting, diarrhea.
I've definitely seen a few patients this week with the GI symptoms and then some with the other. And that's the hard part is when people come in or you're worried, do you have the flu? It can be a vast range of symptoms. And it's really hard to predict. I can have someone come in. Generally, if you come in with fever, you're in the clinic with fever, you're having high fever or something, we generally just say, okay, that's probably flu. Or you're tachycardic, so that high heart rate. We often see that accompanying with the flu as well. But I have people come in that have symptoms for maybe 4 or 5 days already. They kind of powered through it. They're sitting there very calmly. Then they say, hey, I just came in because I wanted to get checked because maybe they're traveling or something, and they still pop positive. Wow. So there's a different range of what the symptoms may be.
That makes it tough for us. And since you mentioned range of symptoms, let's talk about versus common cold and COVID-19.
Perfect.
The common cold doesn't usually have the associated high fevers that we see with flu, even though I love that the CDC website has an asterisk that says not all patients with flu get a fever, which makes it
very true.
Even more complicated, especially since so many of us medicate when we don't feel well. And usually like the muscle aches and fatigue aren't quite as bad with something like the common cold. COVID-19, they usually say the symptoms tend to last longer than you see with flu. Like you mentioned, somebody coming in at day 4 or day 5. With COVID, it could be, week 3,
right?
End of a month, something like that. And overall, we really tend to worry about that more in the very, very high risk population. So the very old, the very young, pregnancy, like we talked about, and patients with weaker immune system. And of note, COVID has also been circulating around recently. It just hasn't been in high numbers as the flu.
It's true. Everyone comes in, they're very curious, what are we seeing in the hospitals being admitted locally right now? At least in our region, it is mostly influenza that's putting people in the hospital, which there were a couple years back when we used to, I was working in the hospital service. And I remember a really bad flu year like this. And it was everyone in the hospital with flu. It was really scary. I mean, we were seeing people on ventilators, and there was a lot of fear about, what's going on. This was pre-COVID pandemic too.
Right.
So it's very interesting that the flu virus has, out of this COVID world pandemic, come back with a vengeance at this point in time, which is actually what the epidemiologists thought would happen.
Yep.
They thought with the way that these viruses mutate, that COVID would eventually kind of calm itself down, lose its virulence, become a little more like the common cold. Still can have a lot of potential complications, especially like Cari said, in those older individuals, pregnant patients. But the flu, just knowing how it works, is poised to take over control again once COVID kind of calmed itself down. And it's that survival of the fittest situation. And there's a lot of really cool things you can research epidemiologically about how it's transmitted and then how it does that pathways where it becomes back in charge again, right?
Yeah, smart little viruses for sure. And of course, one question everyone always asks is, how do we prevent the flu? We just talked about how severe it could be, what symptoms you could have. How do we prevent spreading it to each other? Well, of course, the CDC recommends that everyone 6 months of age or older get a flu vaccine yearly. The flu vaccine is designed to protect against the most prevalent strains of the virus. It's somewhat of a prediction game, and it's not perfect, but overall the goal is to reduce severity of symptoms and lower the chances of those complications that we mentioned. Also, it's really important to wash your hands, soap or water or an alcohol-based sanitizer. Cover your mouth or your nose if you're coughing. Try to avoid contact with others if you have symptoms. And also at home, disinfect those high-touch areas like door handles, for example, because the virus can stay active for up to 24 hours.
Everyone's always asking me, like, do I need to get the flu shot or not? And I'm telling you that, we have seen that those who do get the flu shot usually typically have less intense symptoms if they get the flu. Yeah. And for that, I have patients say, well, I got the flu last year, and they said, I am all for the flu shot. So those who have had the flu in bad case, they're going to get their flu shot every year. So even if it may not prevent you 100% from getting the actual flu, the flu shot can help you so that you don't have the more severe complications that are putting people in the hospital like we were talking about. But, if you begin getting symptoms of seasonal flu, you're kind of worried about it. There are prescription flu antiviral drugs such as oseltamivir or Tamiflu. There's another one called Xofluza that's available. And the thing with these, though, that you have to take them as soon as possible. You have to take them within the first 48 hours for them really to have any effect. And studies have shown it really actually only reduces your flu symptoms by about 12 hours. Hey, if you feel horrible, imagine that 12 hours might be like a lifesaver to you. So you may want to go ahead and start it. But if you're just not sure that that's something that your symptoms are minimal, you're not at high risk, things like that, you may pass on it. Some people just say, hey, I'd rather power through than get the side effects from Tamiflu, like having the diarrhea or nausea that comes with it. Other than that, though, treatment is really aimed at rest, hydrations, medications for fever, aches, chills, some decongestants if we need to so you can breathe. There's a lot of things that you can do. Antibiotics do not work. Also, steroids are probably 90% of the time unnecessary unless you have something like an asthma exacerbation underneath and you need it to reduce that inflammation in the lungs.
Yep. Absolutely.
Since we're talking influenza today, we're going to go ahead and shift to the second part of our episode and talk about the contagious avian influenza or the bird flu, which everyone is talking about right now.
Yeah, it's all over the news feed, On a list of things I don't like to bring up on this podcast, first up would probably be the P word or pandemic. I think we all have some trauma from the last time we heard that word being thrown around. And I don't like hearing or thinking about it, but it is in the headlines again. So we're going to talk about it.
Agreed. We're not here to fearmonger, but there have been some headlines citing, fear of possible bird flu pandemic in humans. What's going on? What does that mean? Is this something brand new that we've never seen before?
Right. And really this issue started back last spring. That's when they started seeing reports of H5N1 or bird flu popping up in dairy cattle. And it is of note, it is a type of influenza A. So people kind of always ask that. And we just discussed the difference between influenza A and B earlier in this episode. The virus itself is widespread at baseline in wild birds. But after the reports of the virus in cows started, we started then seeing it in domestic poultry. Those are the chickens that lay your eggs. People in close contact with either of these groups could contract the virus, although risk to humans is really actually very low. They've had 67 confirmed human cases and 1 death in an elderly person. That's it so far. And of note, the highest number of cases started out and have been seen in California.
So it's important to note that the federal government does have 2 vaccine candidates already in stockpile, but they both take a long time to produce on a large scale. What the government is wanting is a mRNA-based vaccine. mRNA is a molecule that carries genetic information from DNA to other parts of our cells that is often a target for vaccines. Interestingly, it appears that some of this research has been going on for a while with the goal of creating a universal flu vaccine that could protect against all forms of influenza, including those seasonal ones that we typically see and the current bird flu strain spreading in those dairy cows.
Yeah, very interesting. And we mentioned that all the human cases have been seen in people with close contact to poultry or dairy cows, but someone might want to know what symptoms are seen with bird flu.
So with bird flu, it would be symptoms seen with seasonal human flu that we already talked about earlier. Although the symptoms are the same as seasonal flu, your risk with seasonal human flu is still way more likely. Yeah. With 5 million cases seen in the U.S., the flu season so far, again, make sure you talk to your doctor about a flu shot if you haven't already. Also, you have the above listed symptoms we talked about. Seeing a healthcare provider, you want to mention that if you did have any close contact to, dairy cows or poultry, and where we live locally, there's a lot of people.
Very applicable.
It is. We have, maybe not as many dairy cows locally where we are, but we have a lot of poultry. I mean, I know lots of people that have, they have their own eggs, they have their own chickens, they do all of that stuff. But it is something just to be aware of. And there is a huge push right now for trying to control this. And this is also why you can't find eggs in the grocery store right now, is because the government's trying to come in to help with that.
Yep. And of note, I did see actually a news flash this morning that there is a different strain causing bird flu as well that has been popping up in small numbers. So that's also something that they're watching. It may not just be one strain that's causing this issue. And overall, the symptoms for bird flu, it's treated the same as if you have the human seasonal flu. You can actually, I've seen some people prescribing Tamiflu for this. And just like seasonal flu, the goal is to taking the medication is to decrease the spreading and severity of symptoms.
So as with all infectious diseases, you want to make sure that you're washing your hands. I know we say that a thousand times over, but it's true. And then also your kiddos' hands, right? I mean, I know my kid is, he's fully potty trained, but I still get kind of nervous. I'm like, you have washed those hands. Let's just like triple wash them before we walk in the kitchen or touch things. And it's really important that you are wary of that. I counted one time in clinic how many times I washed my hands in a day. 72 times in one day. The amount of times we use hand sanitizer, wash, all of those things. And so if you're not just washing when you go to the grocery store, and when I say washing, yes, washing with soap and water is probably your best bet. Yeah. But using hand sanitizer is helpful with this setting. There are infectious processes you cannot kill with hand sanitizer, and Cari knows all about this because there are certain ones that her field, especially, that you really have to use soap and water. Hand sanitizer is not effective. So if you're really trying to do the most benefit, do soap and water. And then if you want to throw in some hand sanitizer later for things like, touching a gas station pump, or be at the grocery store, that's a great option as well. Use those little cart wipes. Really try to use something like that to get that.
I do a lot of the sleeve over the hands as I'm opening things to try to decrease it. And then I have hand sanitizer on my kitchen table because at least I'm not convinced my kids wash their hands very well. I make both of them do it right before they eat just to try to decrease a lot of infectious diseases, including gastroenteritis or diarrhea.
I mean, we, this episode didn't even talk about norovirus, but, we have a whole other set of, viruses that are really high right now, making a lot of headlines too. But, back to like bird flu, if you want to specifically avoid this, right now you're really thinking about avoiding sick animals and wearing the appropriate protective clothing and equipment if you're around these types of animals. There's no evidence that anyone in the United States has gotten infected with avian influenza A virus after eating properly handled and cooked poultry products. So you don't have to worry about not, eating chicken, not eating eggs, things like that. That's not what we're talking about. But it is possible that might have been seen in other countries. So it's actively being monitored. So it's something to think about. Pay attention to the headlines. Don't, we're not trying to fear monger, get everyone crazy, worried, but it is something for us to be thinking about.
Yeah, absolutely. And in general, if you consume not properly handled or cooked poultry or eggs, you have more issues to worry about than just the bird flu. So just keep that in mind.
There's other things. There's cultural dietary stuff too. So you got to think about those things. Or what is one of our favorites with kiddos, especially, is like, I was making brownies the other day and you're doing raw egg. You have to think about what happens with, we're talking about salmonella. I mean, that's something that is going to happen. You're more likely to get salmonella from those raw eggs than you are bird flu.
For sure.
So really thinking about how your food is cooked, how these things are produced, where you're getting it from is really good. But don't stray away from your local farmer's market necessarily and say, oh my goodness, now I can't go buy eggs from there. We're not at that level. We're not at that case yet.
Absolutely. What I think is really interesting, what's really made headlines, is the fact that the Department of Health and Human Services actually announced that it's providing about $590 million in funding to Moderna, which I know people have heard that company all around with COVID, in part to really fast track the development of an mRNA vaccine that targets the strains of bird flu that we're currently seeing in wild birds, poultry, and dairy cows. This is in addition to the $176 million that they gave them this summer to also look at this.
So, with mRNA vaccines, that came into the atmosphere of, the regular world discussion during the pandemic a couple years back.
Before that, people didn't know what that was.
Right.
Most people.
But they were around, right? mRNA vaccines are not brand new. In fact, it was something that they've been trying to, one of the ones I think I've seen the most studies on was trying to come up with an Ebola vaccine. And so they thought an mRNA vaccine for the Ebola vaccine, you should use in especially countries with high Ebola outbreaks, was going to be very effective. The problem, and good thing, I guess, it's good and bad, with Ebola is that Ebola is extremely contagious. Terrifyingly contagious with terrifying symptoms. But it's also very, very fast in how lethal it is, that generally people do not have time to actually go spread it. Because they die. It's horrible. But with that being said, if you die quickly with something and you don't have enough time to spread it, it actually means that it doesn't get spread very quickly. Right. So you don't end up with these pandemic situations, right? Whereas things like the flu, you don't have as much lethality, but you have a high infectivity rate. And so it can be spread very, very quickly, very widely.
Yeah.
And that's actually prime target for things like COVID and flu is they want the virus itself. It's in its prime spot when it hits that perfect sweet spot where it doesn't have this high lethality rate, but it has a high infectious rate.
Yep.
Going back, but that's why you don't hear about mRNA vaccines for Ebola. That's why there isn't this vaccine for Ebola readily available. So that technology went back on the back burner until, COVID came out.
Yep.
So my question, Cari, what are your thoughts about the future technology with mRNA vaccines? Do you have any feelings or thoughts about that?
I mean, I think, like you said, it's going to be a big target for things that spread quickly, and whether they have a high lethal component or not. They want to be able to get vaccines moving very quickly. From what I've seen, they're able to produce those vaccines in large scale very quickly compared to other vaccines. So then the issue is basically nobody really wants to be caught with their pants down again. Nobody really wants to be behind the 8 ball if we get another pandemic type situation. They want to be able to have something very readily available very quickly as well. And I think this is just a prime target for that, like you mentioned, because it's like we've seen 60 something cases. It's not high yet, but we don't want to wait until it's thousands or millions or people are dying before we have a very quick vaccine that we can produce. So I think it's going to be a big target for a lot of these infectious disease things that we are seeing that circulate kind of in peaks and valleys, that we can kind of target certain parts of these viruses that are the same regardless of what strains are out there and be able to hopefully prevent really high numbers from ever happening.
I think one of the other things we have to talk about, because most of our patients will ask this, is the mRNA stuff got a bad rap, right?
Yeah,
it got vaccines never need to be politicized. Like we can all talk about so many different things here, but one of the things that's happening right now is patients will say, well, is my flu vaccine one of those mRNA vaccines, right? Whether they know much about mRNA or not, they're just like, well, I don't want one of those. Okay, well, let's put it out there. The flu vaccine is an inactivated virus vaccination. It is not an mRNA vaccine. It is one of our most old school ways that we do stuff. It's not even a live vaccine, which is another discussion completely separate. Live vaccines include things like the MMR vaccine, which is for measles, mumps, and rubella, which is a life-saving vaccine in itself. But influenza vaccine, it's also one of the ones that it's inactivated. You cannot get the flu from it. And I think I talk about this all day long, all day.
Yep, all day.
It is impossible. It is humanly impossible to get the flu from an influenza vaccine.
Yeah.
Everything in that vaccine that's even made with it is out of your body within hours. There's nothing that's going to be left. It's not going to alter your DNA. It's not going to permanently make you, I don't even know what the other things, but you cannot get the flu from the influenza vaccine either. I hear that one quite often.
Yeah. And I just remember in general, you can get some mild symptoms from any shot, any vaccine.
Yeah.
That's your immune system starting to work basically. And a lot of times a lot of times people kind of mistake that for early symptoms of something infectious versus it working in your immune system responding as it should.
We'll also throw out the fact there that you could it takes about 2 weeks to have some immunity built up from that vaccination. So you could have already been exposed to the flu.
Yeah,
you could be exposed within those 2 weeks and then test positive for it. So testing positive for the flu after that time, after you get the influenza vaccine, is not from your flu shot.
Yeah.
We can confidently say this. We have tons of data and tons of years on the flu vaccine. So whatever you may feel about any other vaccine type, the influenza vaccine we've got a lot. It's pretty simple. We have a lot of data on that one.
Yeah, no, absolutely. And people have a lot of concerns about that with mRNA vaccines. But again, I think that's also why they're trying to look at these targets early. So it's not something that has found to be rushed, whether that's just the optics of the public, as far as for how quickly things have been around. I think they want to be able to try to take some time when things are not at a pandemic level to be able to research them and put people's mind at ease potentially in the future. Which
is smart, because I do think that if we can reassure public, the public safety about vaccine safety, that we can help with some of the vaccine hesitancy. And I'm not saying every single person needs every single kind of a vaccine at all times. I think that's a discussion to have with your doctor. But I also don't think it's something where you need to go on, TikTok and, Instagram and share all your uneducated necessarily beliefs, just because, you say, oh, well, flu shot gave me the flu, I'm never getting it again, things like that. We really got to be careful with that.
Yeah. And if you ever have any, not concerns, I would say, but questions about whether or not they work, you really just have to watch the pediatric population, because we've had over the last several years, I don't know how many times we've seen record numbers of MMR, for example. It's been on the rise as well. I know this year it's been another issue because vaccination levels have waned because people are concerned.
We have a case locally announced yesterday where we live currently with a positive measles case, which honestly, it was terrifying to me right now. And it's very interesting because it's the first time I've been in this situation where I saw a positive measles case and sat there and said, oh my gosh, my 10-month-old infant isn't old enough to have the MMR vaccine. So he is susceptible right now.
Yeah.
So if my child came exposed, and measles lives in the air for 12 hours. So there's a reason that sometimes pediatricians actually won't have unvaccinated patients seen in their clinic at all, but some of them will also say they have to be at the end of the day, because let's say we did and this is rare, but if you had a patient come in that had measles, so generally they'd probably be an unvaccinated child with measles in a waiting room with, let's say, my child that's 10 months old, my child's not vaccinated is going to be exposed to that, even in the air. Let's say that person wasn't even in there. They were in there 6 hours ago. And that's really terrifying to me as a mom right now, is that I can't do anything for my own baby. And I think about all the other moms that have little kids that young, and, you don't want to not go to places that are the grocery store. A lobby of your pediatrician's office. There's things that you've got to think about. And so, we are sit here just to bring medical information to listeners. We never want to be shameful of the decisions. We also want to be very careful about people's fears or concerns. As a mom, I get now why some parents, especially ones that are not in the medical world, get really nervous giving their kid vaccinations. I've had even, as a mom myself, I would get his shots, even his flu shot. I sit there and I'm like, do I have to do this?
Right.
Do I have to see my baby in pain?
Yeah.
Do I
have to get 4 shots at a time?
4 shots at a time. I get it, for all the reasons. And then you sit there and you're like, I don't want to I get nervous giving my kid Tylenol or Motrin. Right. And so I can see that amplified quite a bit. I can see the fear and the just wanting to be the best parent, take care of your baby the best way possible. It's what we've talked about previously. We talked about like the ultra processed foods and all of those things and avoiding certain things. There's a level of it where it is okay. But then there's a level of it where we're putting our own children at risk or other people's children at risk. And so really watching, like Cari said, those cases, especially in areas with high measles outbreaks, following those trends, seeing how those trends are increasing and why, and looking at the vaccination rates, and then thinking about maybe it's not just for your kiddo, but it's for my kiddo. Mine that's 10 months old, and I would love to give him a vaccine, but I can't because he's not old enough yet.
And people that don't think it's a big deal have never seen a child with those things is the problem, because us that have, it's scary.
It's really scary.
It's really scary.
It'll haunt you the rest of your life.
So, that's what I always say is like, you see one kid with that and you will never question it ever again.
There's a lot of things we see, like things like choking and things like, burns and all these things that you do. Being in healthcare is hard. In healthcare, you see a lot of stuff. It either makes you a mama that's, ultra crazy, or one that's just like, you can't control it. Let's just go.
Right? Absolutely.
I think there's 2 ways to go, right?
Yeah. And on a obviously economic, I would say lighter note, because for a lot of people it's still a serious issue, but with the bird flu specifically, like that's why we're seeing prices of eggs going up, right? 17.2 million egg-laying hens have been killed by the virus in November, December alone. That's a lot of eggs. And another 8.3 million died in January. So obviously less hens means less eggs. Eggs are more expensive,
And, also their federal government has to kill off those infected ones as well. So, you have a wide range of reasons why our egg prices have gone up dramatically.
Yep. Absolutely. Well, that's the shakedown about the current bird flu and seasonal flu. So don't forget, if you're a listener claiming CME credit, please look in the show notes for instructions.
And for all our listeners, thank you for tuning in. Please like, subscribe, follow us on all our socials, and share this episode. Let us know what other topics that you're interested in using our Instagram or TikTok, and stay tuned for our next episode.
Thank you for listening to the MedEdit podcast. Please click the follow button to be notified when new episodes become available. For more information about this episode, and to learn how you can reach Dr. Cari Sorrell and Dr. Jessica Gray, please visit today's show notes. And don't forget, click that follow button to be notified when new episodes become available. The information and content has been made available for informational and educational purposes only. and does not constitute a physician-patient relationship. If you need medical advice or help, contact your personal physician. The views and opinions of the guests do not necessarily represent the views or opinions of Dr. Jessica Gray and Dr. Cari Sorrell. This podcast should not be considered as an alternative for medical advice, diagnosis, or confirmation of an illness or disease. Please seek assistance from your personal health practitioner.